There are two things that scare me the most about dialysis, and the first one is the fear of the unknown. You never know how you're going to feel, you never know how your treatment's going to go, and it's just very scary not knowing what's going to happen. The other thing is the dependency on the machines. We need to get to dialysis. We can't miss treatments.
The scariest aspect of dialysis for me is the possibility of myself or a member of the dialysis team using an improper aseptic technique, which has the possibility of causing an infection, sepsis, and in some cases death.
I want to feel as safe in my unit as I do at home.
I believe that patients are one of the main components of the care team, and safety is in the patient's hands.
To be an observant person and to watch and listen and see what's going on around you. If you see something that's wrong or you don't feel that's right, even if you're not unsure of it, to tell somebody.
You have to communicate with one another so everybody knows what is happening and so everybody is comfortable, especially the patient.
If we see something or if we feel uncomfortable, it's our place as part of the care team to speak up.
I always have a patient that sits across from me and she has the access in her arm, she falls asleep and the arm is like this. It just happens, it's inevitable, so I tell them. And they must fix her arm about 14 times, but I don't let it sit, I tell them.
You shouldn't feel like you can't say anything anyway, especially saying that if you're a family member, somebody who is on dialysis, you should be able to have a voice just so much as the patient as well. This is your family.
When you walk into a dialysis place, or roll in as I do, you hope that everybody knows their business, what they have to do, because my life is in their hands.
I believe that patients are one of the main components of the care team, and safety is in the patient's hands.
Knowledge, I think, would help to keep you safe. So you know what they're doing to you. They give me a medication through the machine, and you have to know why you're getting that.
Be an educated patient and to know why you're on dialysis, what medicines you're taking, what diet you should be on. Just know all about dialysis and know as much information as you possibly can, because that'll help the safety of the unit and the safety of yourself.
If they tell you you can't have foods with high phosphorus, you have to find out why. And what are those foods? And what exactly is phosphorus?
The ideal scenario would be for all patients to be familiar with your blood work, know your numbers, and adjust your life accordingly. Your care team is closer to you than your family sometimes because you see them so often. And you have to develop a rapport where you can be able to speak to them candidly. And that's what makes me feel safe.
I happen to be one of the lucky ones because I'm in a place where the nurses, from the nurses to the housekeeper, they're very professional. They earn my trust because I sometimes ask them questions and I know what the answer is and they give me that answer. So I know that they know their stuff.
The patient and care team relationship is paramount in making the dialysis experience safe for the staff as well as the patient.
The nurses and the technicians, everybody they just seem like they're very on point. They actually care about the patients, they care about their job, and you can see the compassion and they really care about what they do.
Most dialysis facilities, and I've been to quite a few in my dialysis lifetime, I would say for the most part, technicians, nurses, the dialysis facility staff, they want you to be safe, they want you to be comfortable, and they want you to be happy.
If I was the administrator of a dialysis unit, the way to make it a safe unit, again, would be to make patients feel safe and secure. I would want them to know that if they saw anything or felt uncomfortable in any manner, they could come to me or any of the staff.
You are concerned about if I say something, is something going to happen to me? So I think as an administrator or as a leader, one of the most important things would be to have an open dialogue with the patients on a regular basis.
It's a whole package deal. They're concerned about Tara, not just the dialysis. And that makes me feel special and loved and cared for. And that's what you want to do to dialysis patients, because everything in their life is a little bit of a roller coaster.
Patients need to feel safe, and they should feel safe. And thank goodness our government has made so many improvements over the past years.
The people in dialysis, I just want to thank them for for keeping me alive every week.